Welcome to Phoenix Rising with Dr. Z. This podcast is all about conversations about healing and rising from the ashes of your grief and trauma. I'm your host, Dr. Christina Zampatella. It is my sincere hope that this podcast is going to give you the words and the understanding to help you heal through your grief and trauma.
And also there are all these things over here next to the must-dos are the wanna-dos. So if I want to get myself to the things that I want to be able to do, like go to Venice even if I can't drag my suitcase, and to your point, going to Ireland but taking an extra day to sleep, there are accommodations that we have to make. Right. But I think there are a couple things that come up for me. One is obviously having a support system. Huge. Which is, I think, by far the biggest thing. Because to do any of this either on your own, which I think is horrifically traumatic to have to do, but even worse is doing it with non-supportive people around you. People who...
Problematic social support.
Yes. Who diminish your illness, who don't believe, who think it's psychosomatic, who can't show up, who can't go to doctor's visits because they're squeamish, or they can't hold the vomit bucket from you when you're throwing up from your chemo. I mean, all these things.
Won't be there at the hospital, won't come up and visit you when you're there.
Won't come up, won't drive you there, won't pick you up, or won't listen to you. Because there are times too, I find for myself, where I talk incessantly about, what's going on with my body. And my husband very patiently and lovingly listens to me, go over these same things over and over and over again. But that allows me a place to put so much of that anxiety with love and support. And, my flip side is I will listen patiently and supportively to when he talks about baseball for 2 hours,
Oh my God, we're married to the same freaking person.
Exactly, right? No, but
we should have let them hang out today, because that's like their thing.
They would have done their thing.
So what do you think, I have my own thoughts about it, but I'm curious about yours. What should people who don't have healthy social support or enough social support, what do you think could be helpful?
Therapy has got to be on the top of the list, right? Because in a therapist, as you know, finding a person where you can, first, there's so many things around that, right? You have a schedule. It's something that keeps you moving from a routine from week to week or month to month, however often you're seeing the person. Someone that will 100% support you saying anything you want to say, right? All those we talk about that in grief, right? All the ugly thoughts, the things you're not really allowed to say, the things you're not supposed to say. Yeah. You have the floor, and the person will let you say whatever you want, and they will never judge you for that. The person then also will teach you, hopefully, skills and highlight the things that you can take control of, the things that you can learn, or give you suggestions for books or videos or other groups. Finding peer support,
I think that's huge.
Is enormous.
I'm glad that you point, and it does not have to be professionally led.
No, they're different. They're complementary.
Very, very
they're
different.
Super important.
They
because,
are, both of them.
And I found that particularly in grief, right? I had my work that I did with you, but going out into the community and finding not a general grief group, because that was the totally wrong place to be, specifically a grief group for parents who had lost their child to an overdose. Not their adult child, their child, in the same age category as my son, who was 19 when he died. Those people, when I open my mouth, they know exactly what I'm talking about. And they, same thing. I wouldn't say they're never judged, because there can be judgment in grief groups. It's interesting. There's hierarchies even in the grief community, right?
Yeah.
And even at that micro level, there are hierarchies. But it's a place, again, where you can come and vent and say things that you feel like when you're saying them in other spaces, you're a burden. But when you say them in the groups, or when you say them in therapy, it's not a burden. And that, I think, is key.
And already it's feeling like a burden, the illness itself.
Right.
So to have a little bit of relief, like a release valve. Yeah, release valve. I can see could be super helpful. But I do know that there's a saying, and I probably said it many times, joy shared is joy doubled, but grief shared is grief halved. We are meant to be in clans.
Yes.
Our brains are hardwired to keep us alive, literally, from way back when, to be in a clan. So I think that it's an imperative. It's a
Yeah.
life. We're already potentially, for some of us with
Yes.
chronic illness,
Right.
it could potentially be life-threatening.
The last thing you want to do with a chronic illness is isolate yourself.
Yeah, absolutely.
It's absolutely. And the wonderful thing about peer groups is they're full of people with ideas. They will tell you, oh, have you asked your doctor about this medication? Have you tried this therapy? Have you used these? For me, it's like these eye drops. And have you done this? This is how I learned about these new lenses that I'm getting. They're a wealth of information from the patient side that will give you, and they're so kind and helpful in sharing, information. I moved to Minnesota. Where's the closest rheumatologist who specializes in this? What did you do when your dental bill came in and you couldn't pay? I mean, any question is fair game. And a lot of questions come up. How do you deal with your spouses when it comes to, for example, your sex life? When that changes, and 30 women will instantly answer and say, "Here's what we do." Don't give up.
And people won't even talk about that. I mean,
No,
your girlfriends
taboo, right?
might, or whatever. Or you may not even want to talk about it because that's something that's coming up. You were saying something, and it's also, I think, depending on what kind of illness you have, is being able to reach out to the actual social organizations out there that can link you up with resources. So then maybe you're not feeling so hopeless. And if you're in a type of illness in which you can't travel, so much of this is online now, which is one of the things that came from COVID, I think, is, being able to provide resources, and they don't cost money.
Right.
Which is another thing, because people with chronic illness often cannot work.
And they carry horrible medical bills. And
look what the hell's happening in our system right now. A lot of people are being threatened by that. Like, am I going to even have health insurance? So that's like a whole nother layer that we don't even have time to get into.
And that's why I feel extremely privileged when I say I travel to Hopkins and go through, and I can get in my car, fill it with gas, and pay the toll to go across the bridge.
And I won't go right here because I won't name the hospital, even though I could if I wanted to. But I don't trust it.
So that was the same thing with the guy who wanted to take my lung out. That was in a town where I'm like, they're not trustworthy.
I ended up going to Penn because
Penn
Penn specializes in leukemia. And then I found the oncologist I found. She specializes in my kind of leukemia. And she calls me out on my shit. Like, I remember when I don't even know if I talked about this, but when my dad died and I wanted to fly right out to go see my mom, I was still very much, my, like, I don't know if it was my platelets were low or something was, I needed an infusion of platelets. So it had been that. So, and I was like, but I have to go out there. Like, my mom's alone or whatever. And she looks at me, she goes, "Do you want to die?"
You really, must we go there?
I'm like, well, clearly I know the answer to that. And so having to do that. And then the week after, when she died, and having to go back out there and knowing I had to go back out there.
You came home in between?
When my dad died, so my dad, I'm not laughing because it's funny. I'm laughing because it's so freaking ridiculous. So he falls down the stairs. He dies August 18th. I fly out there. I think I'm there like the very next day, as fast as I could.
You get the infusion first, and then
I got the infusion, and then I got out. I got on the plane. I think that day, masks and the whole 9 yards. So then I get there. She's my mom and dad were very enmeshed, very much in love, but they've been through hell and back, and they were 20 when they had me, and now I have empathy because, my God. If you gave me a child at 20 years old,
we would have been a mess.
But somebody would have had to call me out. But and some people do it amazingly well. I don't think I would have. But anyway, her whole world, as it often does when there's an unanticipated loss, it's traumatic, because with him falling down the stairs, it was unexpected. It was violent. She had him in her arms when he died. As he's there were. She had to give me all. She needed to share her details with me. But at the same time, I didn't want to hear them because I had my own. But I had to shove my own. This is what happens with siblings a lot of times, or children, having to push your own stuff aside to sometimes take care of your parent. And she I don't know, in their older age, she kind of became like the housewife and my dad became the worker. It just, the roles became like defined like that.
Right.
So she didn't know their bank accounts.
Right.
She didn't know, she also started with macular degeneration. So she wasn't driving. She would not come. I offered her to come out here. I was like,
Right.
even for a month, Mom, like just let me take care of you or whatever. Wouldn't do that. And I understood why. She don't want to lose everything else. At the same time of losing my dad. Exactly.
This is like my space.
Right. These are my anchors, right?
Yep.
And at the same time, like, well, I can't stay out here for a month because I'm still sick. Well, actually, I'm still in chemo. I'm still in remission.
You have to go back.
But I'm in chemo. I'm in treatment.
Right.
And then so I stayed there for like 6 days, and I mean, I had to go to the hospital in the middle of it because I still needed another infusion. And she was so absolutely traumatized that they treated her too. And they knocked her out with 2 Valiums, and she was sleeping in the room while I was sitting there getting the infusion. Yeah. And that's exactly what she needed. And I was like, okay. But we would go places and she would disclose, my husband just died. We would go to the CVS to pick up medication. My husband just died. I mean, she was just so, I did
that when I lost my son too. I went to pick up a necklace. I said, I need a new necklace because I want to put this particular charm on it. And they're like, oh, and I said, yeah, because my kid died 2 days ago. They're standing, the poor jewelry person is like,
let's do it.
What are you telling me? So I'm like,
same thing.
This is me.
Absolutely.
And this is my reality.
Absolutely. I did it a lot with, absolutely. So I'm there 6 days. I fly out. She and I had an argument the day before, but they only had one bed in their house. So, I slept on my dad's, no, I slept on my mom's side. Anyway, whatever, it doesn't matter. And we held hands. And I think I was so frustrated with not being able to express my grief and turn to her with my grief.
Yes.
Because there just wasn't space for it.
Right. It's that grief hierarchy.
Again, the hierarchy.
Where you take
Exactly.
Your roles. Right.
Exactly.
Yeah.
And we held hands and she goes, I'm so sorry we fought. And I'm like, I'm sorry too. Of course we did. I mean, the pressure.
Yeah, right.
And so we apologized and kind of just laid there holding hands for a while. And I flew out the next morning. And when I landed, it was so traumatic that I can't even
memories get very discombobulated.
Exactly.
Disorienting.
So how did that work? I left. Anyway, I'm losing the days. Anyway, when I landed, I was like, hey, I'm home. Hey, I'm not hearing from you. Hey, why am I not hearing from you? So this had to be, I don't know, a day.
So she passed?
So she passed while
you flew home.
The day, I think I left in the morning, but then I called her later on. So she must, I can't even remember. All I know is that, I can't remember because I was so traumatized from it. All I know is I had to go through this whole thing where, and I know this is off topic, but whatever. I was trying to get a hold of her. We didn't have any family out there. I contacted her landlord and I was like, Janet, can you go over there and see if my mom's okay because I'm not hearing. So she goes over there. She's knocking on the door. My mom's cat's inside and he was an indoor-outdoor cat. So that means she hadn't let him out in the morning, but the door was closed. So the night before she had let him in. So I knew that she had been, at least that.
Yeah.
And then she's knocking. She goes, I don't see her. And I'm like, Janet, are you willing to break your window open in the back? So she busted the window open out back, unlocked it and went in, and my mom was laying in bed and she goes, Chrissy, your mom's gone. Oof. So I was on the phone with her.
For her to experience this as well.
I know,
You're just going over to check on the elderly neighbor who you're kindly checking on, and now suddenly you're faced with the death.
And then I found out she had taken the urn or the box of my dad's ashes and put them on his seat in the living room. That was the night before, after I'd left.
Right.
And so I'm going, oh my God, did she kill herself?
Right. Right.
Because I know she had an ear.
course.
Yeah. And so
Yeah.
I said, Janet, we filled a prescription for Ativan before I left. I need you to go and count
Go and
them.
check. Yep.
And she hadn't taken any more than what she took so it'd been like 3 days. She had taken 4 of them.
Broken heart.
So literally, and the medical examiner said,
It's
you
real.
couldn't, he goes, she didn't suffer, anything like that. But still.
I
like,
think that
it
story
was,
of you holding hands in bed, though,
right.
that is so
Oh my God,
powerful,
the unfinished
so
business
sweet. Yes.
I would have had with that if I had left on a oh my God.
Right. And even sleeping in your parents' bed, it's like you're a little kid again.
And I often did feel like that, right? So we ended up, one of the things that crushed me and still makes me upset, because I haven't died yet, so I don't really know what happens after you die. I got my ideas, but who knows, so they died in August. I was put into maintenance October 1st. So they never got to experience me with my hair growing back.
Oh, and they, of course, they knew that you were sick, so that additional concern for them. They were living with a daughter who has cancer and what's going to happen, but they didn't get to see a remission.
And they were there when I was diagnosed with leukemia. My dad was actually with me when I got the diagnosis.
Really?
Yeah, because I went into the orthopedic surgeon because I had just gotten the knee replacement.
Right,
4
I
days.
remember because when we were seeing it, you were like, I got to get this knee fixed.
So I had this one done in 2019. This one was the one in 2023. And I went in for my follow-up, and they're like, and by the way, you've got leukemia. And I just remember being like, what? And they're like, do not go home. Do not pass go. Right. Do not collect $200. Go directly over to the emergency room at Penn. And
I mean, talk about a traumatic diagnosis, right?
Oh, right. And then,
shock.
And the shock. Absolutely. And so there's a life-threatening illness, right? I'm already dealing with the fact I have freaking epilepsy, which actually did get in the way of my treatment too, by the way. And
which also, just to interject, also your parents have been living with the fact that you have epilepsy your entire life, which, we can talk about 20. Too. Or you were 20. Okay.
It just popped out of nowhere.
Out of nowhere. All right.
Yeah.
But for much of your adult life, they had been carrying that burden and worry about, which is something we should, let's talk about the other stuff too. But the reminder that the people around us, as we do our illnesses, they're living it too, and they're living it without knowing all this stuff. They're not living it firsthand, secondhand, right? So, and they're burdened with knowing that we may die well before the plan. Sort of like we can have all these plans, but they may not be.
You grieve potential futures that you haven't even lost
yet. Right. So they're sort of living anticipatory grief as the caretakers of those of us who have chronic illness. Right.
Exactly.
But let's go back to
no. That was the moment of that, and then there's a whole story about that. But so. Yeah, I could interview my husband if he would ever allow me to put him on a podcast.
We could do both of them. Let's let them come on together.
Do you think I could drag my husband kicking and screaming onto this thing? Well, I'll interview your husband. I'm not going to. There's no way. No way. I think he would do it if he knew he wasn't like being on like the video. Yeah, but it might be. But no.
No. Okay.
But watching him trying to keep his stuff together and then having to run the house by himself.
Right.
I remember he said to me, I had no idea how much you did. And there was part of me that was like, see? And then there was another part of me that's like, I'm so sorry he's burdened with all of this.
Yes.
And yet he has to drive an hour to come and see me.
But it also feels really good to get that recognition to say, yes, we are partners in this life. Yes. We do things together. And it's also heartwarming to know that you're missed when you're not there, right? And that again goes back to having these really strong, supportive relationships.
Huge, you're right.
But then anytime I talk about that, and anytime when I talk about also like about setting boundaries, but taking control and doing all these things, I also always have to pause and say, there are people who do not have that.
That's why I'm at that. That's how I unfortunately turned this around about me. But tell me about what do you think was your process, or what was your set of personality characteristics or skills that you developed that allowed you to get to a point where you're like, accepting the reality of what is going on, even though you're grieving it and you might be kicking and screaming, but you're still doing it because the other option of falling to dismay and not getting out of there was not an option for you indefinitely. How did you,
right?
I mean, does that make sense?
Part of that might, yeah, no, it does. It's a very good question, and I mean, as part of it is base personality. I think just who I am, that I'm an optimistic person generally, but I'm also a catastrophizer and a worrier, and you know, I do a lot of that as well, and I have to check myself on that. And I think, again, as you know, going back to my childhood and the struggles that I've had to face, it's like I have an arsenal of coping skills that I've learned along the way, and I've learned to stand up for myself. If I want something, I have to be willing to fight for it. And if I want to give myself the best possible life I can with these chronic diseases, it's going to be a fight, and I have to accept that somehow, and then cheer myself on and say, but you got this, you can do this, it will make things better. Then again, the flip side, looking and saying, well, what is the other option? That I stop taking the medications, that I don't go and try this rituximab infusion and say, no, I don't want to do that, I don't want to risk the side effects. I mean, by the way, the first 2 paragraphs on the drug insert have the word death in them as a possible side effect during the infusion. You do the infusion in the hospital with constant monitoring because you can go into anaphylactic shock. That's like, well, shit. Really? Like, I read these to Joe and my husband, and I was like, look at this. And no, but yet then not freaking out over that, to say, okay, well, it's in the insert, it has to be, it's information, and again, arming myself with information, right? To me, it's like the more I know about something, the more options I have to choose where I can go with it. And I think I don't know, it's like I dig into some place in myself and I say, well, I just have to. I want to try to make it better. I want to try to live a life that's as good as it can be. And yeah, so I can't smell, but I can do other things. Okay, again, I can't eat everything on the menu, but I can eat this. And then I think there are people who can't eat it all. I don't want to play the, like, you know, the game of like, some people have it worse, some people have it better, but I think that still comes into our way of processing.
What's wrong with saying this could be worse? It doesn't mean other people have it worse.
Right.
It just, my situation right now could be worse.
Could be
than
way
it
worse.
is.
Right. And if I get into the negative side of things, I am actively making it worse. Do I want to do that? Well, sometimes maybe I do. Maybe I need to go down dark places. And maybe I do need to sometimes say, I don't want to do this, or I can't try, or I can't challenge myself. But there's just sort of like this, I think it's just like almost like your internal life force that says, I'm going to just keep fighting.
Resiliency,
right.
and fortitude.
Right. And again, that sense of control. Right,
yeah, so let's go back to that.
Yeah, because I think it's almost the key to all of it. Because if I feel like everything that's happening to me is out of my control, then, I mean, I have no agency. I have no ability to change the course of anything, and I'm just surrendering. But the surrender isn't going to be, it's not like I'm saying, oh, well, help. It's not the same thing as asking for help, right? That's the difference, I think. It's not saying, I can't do this on my own and I need somebody to help me, versus I can't do this, full stop. I gain knowledge, I gain information, I gain support, I go looking for, like when I found you, right? I looked for, was actually, again, I used to say all these women in my life that have been like the pivot points, right? The dentist who found my thyroid disease, the surgeon who did the surgery. You know, when I came to see you, I had just moved from New York to Delaware and needed a new primary. And I was 6 months out after losing my son, and I come to her for a general checkup to start in her practice. And I start crying, of course, like 3 minutes into the examination. She's like, so tell me about your life. And I'm like, right? I lost my son. And like the tears come in. And she looks at me, and this is COVID, right? So we're all masked up, and we're looking at each other over our masks. And she says, you need help with this. And it wasn't like an option. She was like, you need to go get help with this.
That's amazing that a primary even said that.
Nurse practitioners.
Oh,
they're amazing. They're
it's
amazing, right?
Yep.
So I'll just take a sip
No,
of my
please
dry
do.
mouth.
And I'm kind of curious, because we've talked about it before, but I want people to know. You say, and the tears come, but we know you don't have tears.
I can't cry, which is a whole other thing. So right. I went through my son's funeral unable to release a tear because I had no tears to release.
It's like a cry behind it, but nothing.
Everything spasms and it just hurts. And so you're like, you don't even want to do that because it makes you physically hurt. It's like,
Oh my God.
I know.
Can't even.
But again, like, what am I going to do? It's not an option.
Right.
So that NP then said, go find a grief counselor, which then made me start searching. And I can't even remember how I got to the complicated grief group, but because of the university that I work for, they have a whole
very
center.
Famous one.
They're famous. They're very famous. And in that, I called them and I said, well, I work for the same university. And they said, but you're not in state. You have chosen to live in another state, so we cannot treat you. But if you scroll through the bottom are all our providers. I think there's a provider in your state, which was you. Right? So hunting resources, right? It behooves us to know as much as we can and to go find the best help that we possibly can, again, afford, find, logistically get to, and that also we can manage in our schedules, right? Because there's that.
I think we also have to consider social workers in this case.
Yes.
Because this is their gig.
Yes.
Right? So ask until you can find somebody who can help you navigate these systems, including the medical system, which
is a whole nother beast. And I think in my case, having had a child who had mental health issues from toddler years and through his whole life, I had already learned how to not take no for an answer. I had already learned that there are free resources, there are, all these different things within your county and then within your state, and there's NAMI and there's all these different groups, and how to reach out to them and try to find help. Like, don't give up. Don't, just say, I can't do this, because there are people out there very willing to help. And again, huge shout out to the peer support groups, because again, as you pointed out, they're free. They're led by people who are living your reality in parallel. And there are also people who have come through it. I mean, in some cases, right? In your case, hopefully, you'll become the person who's in remission. And now you can be a peer support to the people who are at the beginning of the journey to say, well, look, I'm still here. I, as a person who has survived the loss of a child, can say to people who just lost their child 2 months ago, you can survive this.
You're right. So, and to realize that in all the searching and trying to advocate for yourself and ask questions, don't be afraid. Don't get try to overcome as best you can this kind of white coat. Just assume if one person says something that's definitely the truth, because I went to different people till I knew, like, where I was hearing maybe the same thing, and I'm like, okay, now who do I like the best? Who have I developed most trust with? And it's like, okay, that's who I'm going with. So, and somebody who's willing to pivot. If you have chronic illness or life-threatening illness, which in your case there is that loomingness. I mean, right now you're dealing with the chronic, but unfortunately, I'm not trying to scare the shit out of you, but there is a specter out there, right? So, to realize that there's doctors out there who are just so amazing at being able to pivot when it needs to be pivot versus we're going to just stay this course because this is what they're used to. Right. Keeping somebody who if that person isn't pivoting and your gut is telling you, there's a lot of doctors out there. There are. And if you go to another doctor and you're like, oh no, that sucks, you can do it. Right. And then when you're tired, because you may have the kind of chronic illness that you're like the person that I just interviewed has MS, but extremely well treated, but when she did not find necessarily the hope that she needed to pivot. So she'd have one doctor tell her one thing, another doctor tell her another, until she got to where she needed to go.
Right, which is exhausting and confusing, and especially, depending on what your background knowledge and education is, you may be completely facing all new terms. How are you supposed to understand, right?
And I'm going to say another thing, because I think it's important to say, you and I are white.
Yes.
We have absolute privilege.
Absolutely.
Hands down, the research shows, and in my experience in working with people of color and working with people with many, many different backgrounds, they don't listen to them. They don't meet their needs. They're not culturally competent. There's no cultural humility.
Right.
Their actual access to resources is different. There might be differences in socioeconomic status. Education, the systems in which they're embedded, etc., language barriers, distrust of the system, which can get in the way, as well. And I mean, it goes on and on. So that's another thing I really want to acknowledge.
Right, absolutely, very important. And also, to say that women, often are women's pain to start with, and women's struggles in the medical community. And even looking back at the research, I mean, it wasn't that long ago that they realized that all this research that was being done on mice, which we then base huge decisions on in medicine, were all being done on male mice. Only male mice.
All male, what about women?
Right? Like, what about women? Yeah.
It's interesting how I've noticed on social media, there has been this surge. If we're going to talk about gender and the impact of, navigating the system and not, trying to deal with, in some cases, misogyny, and then what happens in the old way of thinking of, oh, okay, you're just you're just anxious or whatever.
Right, you're hysterical.
So you're hysterical, which we want to talk about where that term comes from. But in social media, people are like, women are starting to go, wait a minute.
Yes.
And I saw a TED Talk about it. I'm seeing TED Talks being, and like also health influencers who are female and male, who are going, wait a minute, hey guys, you need to pay attention. Like your partner or your wife are, going through perimenopause way early than you realize. And so going into the medical system, if it was quiet out here in general, it's quiet there too, and now it's starting to get louder. Yep. I mean, even to the point where, and I know this, well, no, this is not. So on Peloton, which is addictive for me, they actually have a whole section of just, this is a whole routine and everything for women who are going through this, because you have different needs when it comes to like physical well-being. Right. So I think you're right. When we start talking about how are you navigating the system, like a woman who is like, no, blah, blah, blah. Oh, okay. Oh, look at her. She's bossy
being
or whatever.
Assertive without being considered to be bitchy and bossy.
Yes,
right?
Because you're supposed to be a certain way. And again, I don't want to pathologize all medical professionals out there, because I have some amazing, amazing.
No, my rheumatologist is an old white man with gray hair, and he is phenomenal. Right?
Exactly.
But this is his specialty, the disease that I have, which mainly hits women, so he knows.
That's another thing then. Right. Maybe as part of the chronic illness and or terminal illness, to make sure you're finding specialists.
I was going to say, I would say another is like, always aim for the highest degree of specialists that you can find in your, again, with logistics, affordability, again, recognizing privilege or not having it. If you can get yourself to a teaching hospital, by all means, do it.
Huge.
Absolutely huge.
Let's tell what does it mean, teaching hospital? Not everybody knows what that means.
My understanding, and again, as a layperson, is a teaching hospital literally is a place where they are bringing in medical students, and we may have to edit this out and completely revise this definition, but I saw it. My father was in Dartmouth, which is another in New Hampshire teaching hospital, where they're integrating the medical school training with the hospital as a functioning hospital, and there's research being done at the same time.
That's exactly what it is.
Okay. So I got the
Penn's the exact same. No, you got
Penn
it.
State,
Penn's the
Johns
same.
Hopkins, same thing. So you're going to meet people who are in the thick of the cutting edge research, and they have grants behind them that help pay for their research. They're trying new drugs. They're trying new therapies.
Yep.
They're constantly going to conferences. They're super active and really at the cutting edge of what's happening in the field. Plus, you have all these medical students who are bright-eyed and bushy-tailed and interested and excited, and they bring in. So like when I did my thyroid surgery, they asked me, because I was also at a teaching hospital in Sweden at the time, they said, can we bring in the medical students? They watched your surgery. Can we bring them in for rounds? They want to ask you questions now that you're awake. And I was like, sure. I mean, suddenly there's 18 people in my room, and they're like asking me all these questions. One of them, and I'll never forget her, a female student who came up as they all filed out. She was like, can I tell you some stuff? Like, can I tell you some of the details? I'm very, like, gory things don't bother me at all. I said, did you notice how loose the skin on your neck is? And I was like, yeah. I'm like, yeah.
You're like, thanks.
Like, they cut you, because I have a scar. Nowadays, they make tiny little incisions. Mine goes from ear to ear. And she said, they took the skin and they pulled it up and they sewed it into, and they did. And I'm like, that's so cool.
Got a neck lift.
All this, yeah, it's like, wow, like, cool. But her excitement was infectious, and it made me feel special. And that's another thing I was thinking about when we were talking the other day, or I was sending the email about like things. There is this odd thing, and I don't know if other people experience it, but in some ways when you get a drastic illness, you also feel a little special in a weird way.
What do you mean?
It's both catastrophic, but it's also sort of like it puts the spotlight on you, right? Suddenly you are due all this attention. You're sick. You need doctors, you need to go places, you need treatment. And it's like, but it's not for a good reason. But it is still an attention
So you had that experience.
Right. So in some ways it can be like
that experience.
Okay. So that's what I'm saying. Not everybody experiences that, right?
No, I don't want to know you people.
Yeah.
I don't want you to have to.
I'm not sure it's about meeting all the
No,
doctors.
I know what you mean.
But for the people around you. Suddenly
maybe if you grew up and people weren't meeting your needs.
Meeting your needs, right?
Maybe it's nice to have people who are healers.
Well, and I think it's
also, meet your needs.
And we're going again off topic, but it's,
Actually,
I wonder if other people experience this, that it's like, it's almost like you have to pay attention to me now because I'm sick.
Yeah.
Right? It's not that like, be quiet, sit still, don't cause a trouble. It's like,
Right.
no, I'm sick and somebody has to attend to me.
I need the empathy too.
I deserve, not just I need, I actually, because I'm sick, I deserve the empathy. And look at all these doctors who are saying,
Interesting.
yes, you do, right? It
never even thought of
validates you
that.
in a weird way. But then you realize that, well, wait, the cost of this is that I'm sick. Well, like, I don't think this was such a good idea.
But if I'm going to go through it,
Yeah.
let me, because I keep hearing, and we did say we were going to put a pin in, I've got 5 different things trying to come out. Another thing that you talked about was trying to find some, and we talk about making meaning out of things that we've gone through, and things that we need for that is making sense as to what is going on. It's kind of
Right.
benign. Like, for example, you may say to yourself, like for me, is like, okay, everything happens for a reason. Now, don't let somebody else say that to me.
No.
Don't look at me and say, no, I will
Right.
shank you.
Yes.
But I need to come to a place where I say everything happens for a reason, or
Right.
something like that.
Yes.
And then in a weird way to find benefit from it. I can't change the fact that all these people in my family have died.
Right.
I can't change the fact that, I had cancer and, I'm in remission and epilepsy. I can't change that. But what can I do with it? It won't take necessarily the pain away, but it'll help me have purpose behind what I'm going through.
The control
part,
right?
exactly.
Right.
Then there's the identity shift.
Yes.
Who am I now?
Yes.
Because guess what? I was a worker. I was let's just say, I was, I was a vet tech, and now I don't even have the energy to become, to be doing my job, but I identified myself and found joy and purpose in that.
Right.
Now I can't do that.
Right.
How is my identity being affected?
Right.
I was a healthy person. I don't feel healthy now.
Right.
Or I was a significant other. That person left me. Now what? So there's identity shifting.
Huge.
And
right.
and so how do you understand yourself?
And in your
how the world
case,
look at
you went through like 5 identity shifts in months, right?
Oh, I'm still right.
Right.
All the things.
Right. Your dog dies. Your father dies. Your mother dies. You get leukemia diagnosis.
All
of those things are Huge
All of them.
identity shifts.
Yep. And I take all of this and I do what I'm doing right now. I'm doing this.
Right.
But yet still having my moments of just my moment. You have to oscillate.
You have to allow
Absolutely.
yourself. You have to, the compassion to say to yourself,
yeah.
Again, this sucks. I don't like it. I don't want it. I want to feel sorry for myself. I want to cry if I could. I want to be angry. I don't want to do things. All
it's
of
like
that,
you rage up against it.
Yes.
You do that,
Yeah.
and at the same time, try to reconstruct meaning.
Yes.
So that you can pull the pieces back together and do what you can right now with what you have.
Right. But you have to allow yourself those rages, because otherwise you're kind of just being like, well, I'm okay. No, we're not okay. It's not that we're saying that we're okay. We are very broken, but we're still putting ourselves together every day.
We're very strong. I think we can tell the way we talk to ourselves makes a huge difference, right? So, yes, I'm sick, but I'm not necessarily, I'm not broken. Yes, I am not able to do all of these things, but I am also able to do these.
But I can
it's an and, right? It's not an or, it's an and. Right. So I think that's part of the coping, and also making sure that you engage in things that bring you joy to the greatest of your ability.
Right.
If you can get outside, for example, in all of its even if you're sitting on your porch or your whatever.
And that's what comes up very often in the disease page that I'm on for Sjogren's disease. There are a lot of people who are like, I can't, and again, I don't know them personally. I don't know their picture. So I want to preface this with saying that there are people who cannot get out of bed, who cannot do, exercise is not an option. And we have to, very important to recognize that. But I also see that there is a subset of people who have sort of just sat back and given up. And as hard as it is, and they keep getting told both by their families and by their medical teams, try to eat better, try to get sleep hygiene,
little things.
Try to get
Doesn't
out
have to
for
be
a
all
walk.
the things.
No, you're not, again,
Teeny,
you're not
tiny
running
gains.
marathons here.
Right.
If you can get out for 10 minutes and sit on your porch and get some sun on your face, if you can, I also often hear people who are like, they are struggling with their weight and they're struggling with their joint pain and all these things, and understanding that a diet where you slowly, again, it doesn't have to be overnight. I eat cookies every day. Your chocolate is a food group. But also, like, the vast majority of the food that I eat is healthy food, right? And so, and even though it's hard, I sometimes literally drag myself to the gym 3 days a week. I do what I call baby workouts now. I used to run at 6.5, 3 miles. Now I walk 1 mile at 4.5. But I'm doing it. I'm doing something, right?
So you do what you can with what you have at the time.
And you allow yourself to mourn the fact that, okay, I can't do that, but I can do this. And I know that every time I do it, I feel better. And again, sleep, so important.
I don't think anything else works unless sleep works. And in epilepsy, unfortunately, we have people with nocturnal seizures, and so their sleep is all jacked up, and that tends to be a main thing. So I'm hearing you, because if you can't even get the basic activities of daily living down, none of these other really cool,
right? They're not
nothing else works.
Part of them is like, yes, it feels good to go to sleep when you're tired. If you sleep, you wake up. It feels good to eat because you're hungry and you satisfy your body, but you also think of them as, they are literally restorative processes for your body. And the same thing with exercise. Right. But the one I always remind people of also is your mental health. Yes. Do not forget your mental health is that sort of like, if we have the 4 pillars of sleep, exercise, food, and mental health, that one is critical, because if that one falls apart, the other ones fall apart as well. Right? So get yourself engaged in getting help.
I don't know why this just popped into my mind, but thinking about mental health and thinking about food and ingestion, think about what you're ingesting.
Yes.
In
it's a
many
really
ways.
Good way to think about
it. So, if you're sitting around like my husband, who loves to watch serial killer shows, which I've gotten to the point where I'm like, if you're going to watch death-related stuff on TV, I do this for a living. I'm done. Either watch sci-fi and something funny, or I'm going to go read or whatever.
You already have your load of that. Yeah.
I have my load of that. But if you're ingesting that, think about what you're taking in in other ways other than food and breathing. What else are you feeding your body, which includes in your relationships and and doing, you know. And then I also was thinking, pay attention to what your secondary losses are.
Yes.
And all the implications of those.
Yes.
And if you are unsure, please don't think there's a 5 stages of grief. I think I say it on every single episode. But find somebody who you can turn to if you do not feel like you're able to find your resources, which there's a ton, really wonderful ones, but to allow yourself to grieve those losses that are maybe non-death related losses, things of, you know, not only health, but what are you able to have children? You know, are you too scared? Like with epilepsy, there's a lot of women that are terrified because of their medication. And what if I have a seizure when I'm pregnant? And what if I'm holding my baby?
Or what if I scare my kids? My 1-month-old?
Exactly. So
absolutely.
The amount of losses, like pay attention to what those are as well, and allow yourself to move and experience the loss. Because unless you're doing that, you're not looking at the full spectrum of everything that's going on.
Secondary losses are
Huge. But with all of this, there can be growth. You can find out things about yourself that you never, ever knew. Your strengths that you never recognized were in you, maybe before the diagnosis or before you really kind of started considering how to navigate these things different. And if we were really looking even at terminal illness, that's a whole nother layer of
and something that I am not facing right now.
We're so on like this, like, what did you call it? You said it in front. It's this lingering potential.
It's like the specter of it. It's the specter. It's there. It's like almost like a ghost in the closet. We could be heading towards that, but we don't know. But we're not there. And so again, that is a whole nother.
That's a whole nother layer.
That's a whole nother layer.
Wow. Is there anything else you can think of for helping people?
One thing you just brought up. But I was thinking about the growth thing because we had these conversations when you were helping me through the grief of my loss of my son. I still bristle at post-traumatic growth. I cannot wrap my head around it. And I don't know if
it's interesting because I was thinking about using this clip from my post-traumatic growth part of my presentation.
I just ruined it, didn't I?
No, that's all right because I'm still going to show it. But go ahead. I think it's good, important to challenge it. Go ahead.
I bristle at it still.
Okay.
And I think it's the feeling of these horrible things happen to us, be they the losses, the deaths, or illnesses. And there's a little bit of that sort of Western culture aversion to sadness, loss, ugly, we don't talk about, we don't. What if it's not growth? What if it just is? What if it's just, it's ugly and painful and traumatizing, and there really is no upside. There isn't an upside that we because I think what ends up happening is, well, the upside is I'm still here.
Okay.
You look at that. Am I different? I don't feel like I'm different than the person I was before my son died. I don't feel like I'm different than the person before the diagnosis. I'm just me. And I'm me coping with this. I coped with the other thing, now I cope with this. I am not driven to feel like I have to find a silver lining. I have to find the growth. Because I think that and I'm not saying that people don't. Some people do have huge sort of, almost transformations after traumas. For me personally, I worry that sometimes we put that as a burden on people. Go find the silver lining in your loss, and that minimizes the loss. It actually makes me feel like, oh wait, I'm supposed to have post-traumatic growth. I'm supposed to do a fundraiser, start a race, have a bench in a park, start a group. It's like you're supposed to do it.
Have more meaning
what
in
if
life.
I don't have that in me? Or what if I don't want to? Or what if I don't, that's not a driver?
Maybe you're not ready?
Could be that I'm not ready.
Or maybe you don't identify what it is. It's buried still. You're not ready for it. Or maybe you just don't, like you said. Maybe you just don't.
Right. And I think what's important with the post-traumatic growth thing is just identifying there might be two different populations. There may be the people who really feel that transformation, and it really opens up new avenues in their life, new realizations about who they are and what their goals are and where they want to be. I just think we have to be careful about putting that out there as it almost becomes an onus on the people who aren't in that group, that I'm supposed to do these wonderful things.
Yeah, they get this message.
Right.
So, I mean, and that goes along with other kinds of disenfranchising things like, oh, it's been a year, I need to quote unquote move on.
Moving on.
Yeah, and like lots of different kinds of messages that we get. So you're saying, I feel like this idea of, you're supposed to find meaning from what you've gone through in whatever way, or grow from whatever you've gone through, is also another form of disenfranchisement.
Yes, because it also says that I was ungrown before. Right?
Is it?
Sort of
Or is it saying that
disenfranchises the person that I was before, potentially, to not be, was I not just as capable and, all these things before?
But don't we grow as part of just natural human development?
For sure. Is it that we grow or do we change?
Well, that's what I think. That's
and
what we mean.
And I think there's a difference between the two.
Okay.
Because change doesn't always have to be. I think there's a value. It's like it's value loaded when we say growth. It's always like this feeling of we leave that we weren't so good before. Now we grew, and now I'm better. Right? What does that say about the person that you were before?
That's a good point.
And I've had this conversation in grief groups, and it kind of doesn't always come across well to people.
No, but I see why it kind of rages up, not rages, but it smacks up against what we're I mean, even with this training that I'm getting ready to do, the certificate is, I am supposed to talk about post-traumatic growth. But I think it's important for not only the people who are listening to this, but also even the people who are, going through these trainings.
Yes.
To realize that, sometimes we have to look at this from different perspectives. So I'm glad that we're talking about this. I think this is important.
Yeah. No, it's one of those things that has always just bothered me when I hear, and I think part of it is also it's the desire of the people around us seeing us hurt. They want us to be in that better place.
That has a lot to do.
And we can all kind of go, oh wow, she made it through that. Now we're back to normal.
Look how much you've changed. Yeah, that. So there's a fine line also between this pressure, this post-traumatic growth, not fine line, but there's a relationship here. Post-traumatic growth, the thinking that there should be post-traumatic growth, the changing versus growth, and then the disenfranchisement.
Right.
That's sticky.
Yeah, it is. And in your case, and in the case of anyone who's facing a very difficult medical illness diagnosis, when they get to ring the bell, for example, are they now supposed to be this newly emerged, like you're a butterfly coming out of a cocoon?
No, but it's Phoenix Rising. I mean, it's the whole freaking thing.
Right. But
is it?
But is it, right? And what if these people all have this expectation of you that you're supposed to now go around and be extra grateful for every sunrise you get to see, and extra kind to every puppy?
No, I'm terrified of being tired in the middle of the day. Even to now. No, I was crying 3 days ago, 4 days ago, about how I'm afraid to be tired in the middle of the afternoon and want a nap.
Right.
Because that was the thing that was the first thing. Yeah. So it's actually still traumatizing. So you can ring the bell all the way I damn want, but I bet I'm still going to have times where I'm like, great, has it come back? And again, yeah, absolutely.
But also, why are you supposed to be more enlightened because you've suffered?
Well, that now we can get into
Buddhism.
Which now we can get. No, we're not going anywhere there. Well, and then what do I give up to? Yeah, okay, we won't go into that. God, we could. This is amazing.
Talk about this forever.
Yeah, we can. Does this feel like a good place for you to stop?
Yeah.
I just thank you so much. I think this is incredibly powerful, and there's so much that we covered, and I'm encouraged that this is going to land for some people so well who maybe are really confused about it and not feeling validated or understood, or maybe they're looking at maybe a couple ideas that might be able to
Right.
Improve their quality of life, or at least go, oh my God, that's what I've been feeling. So thank you for being willing to do this.
No, this has been great for me.
I'm so happy for it. So, and you keep doing you, man.
I will.
Pretty badass. All right.
That's what I do.
So if you guys have any questions, or if you have any comments or any follow-up thoughts, certainly you can, if you're watching this on YouTube, you can go ahead and place in the little comment section below. Go ahead and put them there. If you have any feedback of any kind, any ideas that we talked about today that you would like to see expanded, and happy to look at that. I look at it all the time. I'm the one that makes sure that I keep a pulse on it, because I think that's important when we're really trying to make sure that we're diving in topics of grief and trauma and how we rise from those ashes. So thank you very much for listening and watching, which is likely in 2 or 3 parts, but very well worth it in my opinion. And, just remember that it takes challenge to awaken the power to heal. So thank you until next time.
Thanks for listening to Phoenix Rising with Dr. Z. If this episode helped, subscribe and share it with someone who needs it. We'll see you next time.